Okay, welcome back, guys. Today, again, we're going to continue with section 3B of this video series where we were talking about postgraduate training in the UK. So my next question to Apurva is, what documents do I need if I'm applying from India or say any other country to get into a training post in the UK? Is there a set of documents that I need to have?
Yeah, welcome back again. So to start with, the postgraduate program in the UK, for the document itself or for the evidence of training, they follow something called as an e-portfolio. So you get a online account wherein you can kind of log everything that you've seen. I'm going to throw a few words now which are very new. There's something called as workplace-based assessments, WPBAs. And it has different categories in it. For example, one of the categories is called a CBD. That's called as a case-based discussion. The meaning of that is, so if you see a patient with maybe, say, breathlessness, you discuss with the consultant and document the discussion and enter that in the e-portfolio online. But however, if you're doing your initial few years of training in India, you don't have an e-portfolio. So what you need to do is you need to get all those documents in a paper format. We can give a link in the description below so that you can have a look at the college website, what exactly the documents are, and you can take a printout of all those documents as well. But however, you need to have all these workplace-based assessments for each year. What you need to have for each year, there is another separate checklist, which is called as ARCP checklist, Annual Review of Competency Progression Checklist. So that kind of explains for every year. For example, ST1 year, what documents you need. So you need to have all those documents in the checklist. This is just regarding the training itself. So apart from this, you need documents which exactly mentions what rotations you have done in each year. For example, if you take an example of emergency medicine, in the UK, people do something called as ACCS, Acute Care Common STEM, for the first 3 years. That includes 6 months of ICU, 6 months of emergency medicine, 6 months of anesthesia, and 6 months of acute medicine or internal medicine. So if you have similar rotations that you've done in India, then it's easier to get a higher level of training job in the UK. Mm-hmm. So it's kind of similar for other specialties as well. So if you're doing anesthesia or internal medicine, if you've done a similar training pathway or similar rotations that people do in the UK, then it's easier to get a training job in the UK as well. So fine. Apart from your MD or DNB degree, if you're doing MD or DNB, apart from your degree certificate, you also need an additional certificate explaining what rotations you've done from what date to what date on a hospital letterhead with the signature of your head of the department.
Fine. So just to summarize this, so we have something called as ARCP, which documents, say, how many cases of chest pain you need to see, how many abdomen pain or PR bleed, that sort of thing. Yeah. And then we can get competencies in this signed off through the work-based place assessment forms. Yeah. I think in my mind, there are 3 big ones. One is CBD, case-based discussion, where you see a patient, discuss with a consultant, and then get that ticked and keep in your record. Yeah. And the other is mini-CACs, where I think the consultant sees you assessing a patient and then again fills the form, you keep that in your record. And the third one is the TOPS, which is the procedural document. If you do any procedure, you can get that signed. And if you are in India or any other country or any other part of the world as well, you can get these, you can download these, get them signed from your consultants, keep for your own record, and also the record of your rotations or your attachments before coming to the UK. So you will have documented evidence signed by your own consultant, and it will be easy for you to get into the training system.
Exactly.
Does that
make sense? Okay. So to summarize everything once again, because I know this is very confusing and lots of new terminologies. So your postgraduate degree certificate, and then description of rotations you have done in India, exactly with what date to what date and what rotations you have done, and workplace-based assessments, which comprises of CBD forms, and DOPS. The number of each component is mentioned in the ARCP checklist. We'll give description of all these in the box below, and then you can have a look. And each college, for example, if you're doing medicine, the Royal College of Physicians has a description of all this. If you're doing emergency medicine, the Royal College of Emergency Medicine has a description of all these, and then you can have a look at exact colleges and then get the document.
Cool. So we'll move to the next question then. Are there any UK qualifications or what do you call this, degrees? Are they recognized in India or valid in India?
Okay. Again, this is probably a complex question. The first answer is yes. The UK degrees are recognized in India. So according to one of the Medical Council of India notifications, the postgraduate degrees that are recognized in UK, USA, New Zealand, and Australia are recognized in India as well. But what we don't know, or what is an uncharted territory, is at what level they are recognized. Probably it's easier if you are going to work in a private hospital or a corporate hospital. It's quite easy to work as a consultant. But if you want to work in a medical college or a government hospital, I don't know anyone who have done that, or how does that work, or at what level they join in. Because pragmatically speaking, I don't see in the foreseeable future this is going to get resolved. For example, DNB and MD both are Indian degrees, but still there is lots of confusion and politics despite them being equivalent degrees. And there's still lots of confusion with regard to working in medical colleges, and people who have got DNB are kind of sometimes discriminated for obviously no reason, which is unfair. So I don't see in any foreseeable future this is going to get resolved, although we hope the authorities take notice of this and come up with a
clear
guideline mentioning what level is it recognized.
Right. Okay. Sounds good. Next question is, if you could tell us something about how does that process of moving to Australia or Middle East work? If I have a UK qualification, is that easier? What does that process entail?
Okay. I'm not an expert on this, and I don't think there is any straightforward answer to this, but the most easiest answer when coming to Australia is if you've done entire 6 or 7 years of training in the UK, and if you've got CCT in the UK, then that is recognized in Australia to work as a consultant. But if you've done like partial training in India and partial training in the UK, that's something called as CSER CP. CP stands for Combined Program. I'm not entirely sure of the answer. So probably you can work in the Australia, but I don't know what the pathway is. Probably it's easier.
For CSER CP.
Sorry, yeah, for CSER CP.
Yeah, okay.
So I think it's probably easier to find out from people if there's somebody who has done this, or directly contacting the Australian Medical Council or the Australian College of Emergency Medicine or Physicians or whatever that college is. Coming to the Middle East, probably it's a bit more easier. Lots of people work in Middle East, mainly because Middle East pays a very good salary. I think it's easier even by your MRCP or MRCM to work in Middle East. Also, if you've done the further training in the UK, like your FRCS or FRCEM, it's quite easier to move to Middle East and then start working.
Middle East, yeah. Fair enough. So if we have full training in the UK, it's generally easier. Okay.
Move to Australia.
Sounds good. Now, again, this last question for this session, it's quite a broad one. I think we'll probably need to leave a link. So what are the specialties and subspecialties in the UK? I think subspecialties, if you just talk about emergency medicine, and for specialties, we'll leave a link in the description box. So what are the subspecialties in the UK? And we'll just talk about emergency medicine here.
Yeah, I think I'll just talk about emergency medicine. So if you've done MRCEM, what you can do after coming to the UK. First thing is you can just do FRCM without any subspecialty. Route 2, you can do an extra year apart from your regular training, and then do pediatric emergency medicine. You can also do pre-hospital emergency medicine. But if you want to do something totally different, you can also do higher specialty training in palliative care medicine and higher specialty training in the sports and exercise medicine as well. But these are completely different two specialties. You don't have to do FRCEM to do these specialties. So you'll be a CCT in palliative care medicine, or you'll be a CCT in sports and exercise medicine. Apart from this, you can also do critical care medicine. You'll get a dual certification in both emergency medicine as well as critical care medicine. But this is a very, very long pathway. So you'll have to probably do at least apart from your regular emergency medicine training, you'll have to do at least 3 or 4 years extra of critical care medicine as well.
Critical care.
Yeah.
Sounds good. I think that's all we have for this section. We will see you in section 4 now, the 4th video of this series. We hope you're finding this useful. Thank you. Bye-bye.
Thank you.